Okay, as a typical test question, for the middle and the lower, we'll probably ask you, I want you to assess elevation of the 7th Costal on the patient's right, in a seated position. So once again, we've made our introduction. I'm going to check, for the most part, the equipment comes neck. I'm going to set it up to the patient's height and check it for security. The patient sits on the stable one, not the mobile one. And then direct the patient, if you could, can I have you sit here, facing pretty much towards the window, if you'd be so kind. Doctor's position. I want to be sitting somewhat behind the patient. And I have the patient fold their arms in front of them. Actually, I'm going to have you first drop your arms, my apologies. In this case, the 7th Costal on the right, I want to find the spinous process of T7. The easiest way to do this is I'm going to bisect the inferior angles of the scapula. That's going to put me on the spinous process of T7. From here, do me a favor and fold your arms. Okay, just drop them in front. My formula first, I'm going to find the TVP, so I'm going to palpate 2 interspinous spaces up and over about 1 inch. That's going to give me about the TVP on this right-hand side. And to palpate the 7th Costal, I'm going to palpate slightly laterally about another inch. And the easy way you'll find is right on the lateral border of the paraspinals is about that distance, so if that can actually aid you in finding that rib. From here, I'm going to put my finger in the intercostal space because I want to feel the movement of this joint, the joint play. So once I have my finger in that intercostal space, I'm going to combine flexion, contralateral lateral bending, and rotation. And what I should feel is that as I do this, that intercostal space should open. To assess end play, I want to bring this particular rib to pretension, so I'm going to bring them forward. You'll feel the intercostal space open, and when it doesn't open anymore, you've taken the joint to pretension. From here, my contact point, either utilizing my thumb or utilizing the thenar eminence of my hand, I'm going to lock into the inferior margin of that rib. I want to position my hand and my forearm so I have my line of drive is predominantly I to S with slight P to A, just enough to lock onto it. From here, I'm lightly going to spring, in this case, I to S, predominantly I to S, and I should feel a giving quality. The rib should have resilience. Ribs will feel like they move out of your way effortlessly. If for any reason you feel resistance or you feel what feels like a roadblock, chances are you're dealing with an elevation restriction of that particular rib.